This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, 888-630-9625, 888-630-9625. That's how you find me here at the studio. And how you find me when I'm not at the studio, rosellecare.com. That's ROSELLECARE.com. Happy Easter, everybody, and also a happy and blessed Passover. I hope everybody is enjoying this very, very high holiday. It's a time when people come together and remember why we are who we are. Enjoy your families and enjoy the day. Get outside and do something that is, gentle for yourself and for all those who are surround you. Have a program today that I want to talk to you a little bit about, and we're going to touch on a couple of different topics. Things that I think that you need to know a whole lot about, and things that are not necessarily the most obvious when it comes to your health. And why do I say that? Well, when we deal with pain is one of those things that happen, and everybody has their thresholds. Some people can tolerate a lot of pain, it seems, and some people seem to tolerate very little pain. And often you go to a physician and they don't know why the pain is there, or they tell you take 2 aspirin and call me, 3 years from now, or whatever it is, and that there's really nothing that they can do. However, you have to understand the matrix of what that phenomenon is all about. This year's Ageless Health seminar in October is going to be about the brain-body phenomena and how the brain communicates and how it causes everything to work properly. And we'll tell you more about that as the weeks go on, and hopefully this year you'll be with us, you'll join us, because it's going to be an over-the-top program as usual. And if you want preliminary information, obviously just go to our website, and it's starting to be laid out within the next probably 2 to 3 weeks. You're going to be able to do early bird registrations. Having said that, and obviously I digress for a second, but there's so much that you need to be aware of when it comes to your health. And the pain phenomena and dysfunction are kind of tied hand in hand, but they also have a commonality. And that commonality often is circulation. It's your blood supply. And we don't think about how blood supply is affected by other parts. We think about the heart, and we think about the heart pumping and pushing blood through the system, into the arms, into the organs, into the muscles, and so forth. But we don't think about what the triggering mechanisms are throughout the system. See, like any other system, the cardiovascular system, the heart and all its offshoots, meaning vessels throughout the whole system, have something in common with everything else. It's called a nervous supply, a nerve supply. Without it, it can't work. The heart particularly has 3 primary electrical circuits. It has nerves from the brain, it has nerves that come from the spinal system, and it has a pacemaker, an embedded nervous system within the muscle of the heart as well. So when any of these things don't work the way they're supposed to, or they fail to function properly, then the cardiovascular system, the heart, and all its branches throughout the body fail to work. But let's focus on one piece. Let's talk about pain, chronic, ugly, nasty pain. Why is it that we end up with a problem that just seems to be, nothing will touch it. Nothing can get to it. So pain generally comes from structural systems. It comes from muscle bundles. It comes from the nerves that go to the spinal system. It goes to, many different organ systems and so forth. And we have these pain patterns, these pain presentations. For years you've heard me talk about inflammatory reactions. But we're going to talk about the inflammatory reaction, but a little differently today, a little tweaks. We're going to talk about something that you hear about on television. We're going to talk about the end product of what that really means. When you hear the term atherosclerosis, what does it come into your mind? Atherosclerosis. It's a far too common chronic system disease. It means that your blood vessels are being plugged, that nothing can go through them. Atherosclerosis. Athero meaning hardening of the arterial system, and nothing flows through it. So we tend to think of the clinical symptoms associated with this disease affecting the coronary arteries, the major vessels coming out of the heart, and we look at strokes and we look at heart problems such as heart attacks or TIAs, small mini strokes, transient ischemic attacks, or just a loss of circulation to the primary systems in our body, if not something that's in fact significant. But we often ignore the fact that this disease, this blood supply disease, affects everything throughout your whole body, every part of the cardiovascular system. Memory problems, sensation, the ability to function on any level, the ability for your intestinal system to work, the ability for your kidneys to clear, the ability to have good functioning endocrine system. A lot of the commercials that guys see on television now with Cialis and Viagra and so forth, guess what? That is a blood supply problem. And if you fix the blood supply, all of a sudden things work again the way they were meant to work. But we're talking about pain. So what I'm trying to do is lay the format out there for you to understand that this is a far-reaching problem. But we're going to talk about it relative to its effect on the spinal system. Many of you have been told that you have degenerative disease of the disc spaces of your spine, that you have stenosis, that you have to learn to live with it. But you know what the interesting thing is? Those of you who have slowly advancing degenerative disease of the bones, of the disc spaces, of any joint space, didn't get there by accident. It just didn't happen to you. Although you can say that you never had an accident, there was no injury, you didn't hurt yourself, but over time, and they say, well, what do you expect for your age? That's not the case. The case is that these disc spaces, these cushions in between the vertebrae, are not getting the blood supply that they were meant to get. And that blood supply is influenced by a lot of different things. It's influenced by the nervous system. That brain controls everything in the body. It sends signals to make sure things work. In traditional manual care, either in the osteopathic profession or in the chiropractic profession, we talk about nerves being irritated, overstretched, or damaged in a way that their signal to a target isn't working. Well, one of their targets is the blood supply. So if the nerves aren't firing properly, then the blood supply can't work as well. You match that with a system that has a lot of junk in it. My mantra of sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. If you haven't heard it before, you just heard it then. Then now you have this inflammatory reaction that causes the blood not to flow properly. And now you have these targets that begin to break down. So we're going to talk a little bit about this cardiovascular phenomena, this atherosclerosis, this hardening, this plaquing. The interesting thing is that people who have degenerative disease that kind of shows up for no reason, you haven't been injured and you haven't had repetitive stress to the joint, it just kind of happens. The correlation is that longevity for you is not good. You die sooner and you die ugly. What do I mean by that? It means that your mind begins to go because there's other places that are clogging and plaquing as well. It means that your organ systems begin to fail. They go into shutdown because they're not getting the blood supply that they should. So when we're talking about cardiovascular problems relative to pain, the problem's silent because this narrowing, this plaquing is slow over a period of time. The nutritional supply to the organ system, the nutritional supply specifically to the spinal disc spaces has now been altered significantly and substantially. Think about it for a second. How many of you have been told, when you go in and you go to your orthopedist, you go to your neurologist, that you have spinal degeneration? Did it ever dawn on you to ask the question, why? Why is it there to begin with? How come it came around? Well, there's a growing body of research out there that is starting to point fingers to certain situations. And you may be a smoker, and what does that have to do with my back? Well, you know what? Ask a surgeon that really has his act together, and he'll tell you that the worst outcomes in spinal surgery are those people who have impaired spinal circulation due to smoking. Well, in the population across the board, advanced aortic hardening, sclerosis as it's called, is very widespread, and more so in the society that we have today that we're living in. The intervertebral discs, these shock absorbers that are in between the bones of your spine, are associated when they begin to break down with low back pain, or neck and shoulder pain, or hip pain, or degenerative joint disease of any kind. As we said, smoking is one of the greatest risks for arterial disease, and it's very specifically correlated with low back pain. But you know what else is specifically correlated with this type of problem? The stuff that you put in your body, the acidic foods that you put in your system, but also spinal injury from what we're going to say unknown origin. What does that mean? Spinal injury from unknown origin means that your body mechanics aren't working the way they're supposed to because of postural patterns, because of sitting, because of inactivity, because of lack of stretching, because of small things that happen over time. We've talked about that over the course of many, many years. The point of it is, and what I'm trying to get you to understand, is that low back pain, often for no other reason, has to do with impaired circulation. There's been studies where, they take cadavers, they look at them, and they see degenerative disease of the disc specifically correlated with hardening of the arteries, aortic calcification. So if that's true, why do we see so much of it? Why is there so many spinal problems that are unresolved? Well, one, because they're treated improperly, and they're not treated multidimensionally, and patients not willing to take responsibility for it. But nevertheless, spinal degeneration has to do with spinal blood supply. And a review of how these things work, you can pick up any anatomical book, Gray's Anatomy, Holland's Head Anatomy, and there's others out there, and you can see where these nerves are being affected by the blood supply, but more importantly, the blood supply also is being affected by the nerves. So it's a catch-22. It feeds on itself. And if the matrix is not there, meaning the food and the blood supply in a good, clean, quality pattern, you're in trouble because the body can't heal. So we're going to talk about how all this works. I'm going to show you the step-by-step where you're going to miss, but more importantly, the things that you should be able to do to resolve the pain due to lack of cardiovascular circulation or aortic circulation. There's in your hip spaces, the sacroiliac joints, the sacrum and the ilium is called the sacroiliac joint. There is a blood system there, and it's a complex set of vessels that contain multiple different branches and so forth. And there's a nerve that influences that, and it comes from just at the fourth low back lumbar nerve root area that supplies that. Isn't that fascinating? So what comes first, the chicken or the egg? We're going to talk about that, and we're going to try to get you to understand that you better make some changes appropriately and start doing some damage control, because if you don't, things just get progressively worse over time. And we're not only talking about pain, but we're talking about the longevity of you on this planet. I think all of us want to hang around for a while because, as long as, the sun rises and we get up in the morning, it's a good day, providing that you're not in pain. We're coming up to a break. We'll be back after some very important messages and some information. Don't go away. This is Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? available. Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem and, you haven't figured it out yet. Well, this is an opportunity to get that done. So call me and let's talk about it. Happy Easter and happy Hanukkah, everybody. Happy Passover. I'm sorry. I'm used to making it around Christmas time, but it's one of those blessed holidays that everybody shares and doesn't happen too often on the calendar, but it did this weekend. So enjoy your families and celebrate your spirituality as best as you possibly can. We have several things that we're talking about, but the most important is we're talking about vascular impairment, and we're going to kind of move on that subject just a little bit. We have several phone calls, and we will get to you, so please be a little patient with me, and we'll move on down the line. Today's one of those days that, in our family, we get to sit and enjoy each other's company, and we started out in a spiritual way. We go to Easter Sunday services, and the whole day has always been historically for us wrapped around the thought processes of that, because that's the center of who we are as a family. And enjoy that moment with your families. Enjoy that spiritual place that is so necessary and, in my opinion, so lost in our society today. So take the moment, try to, ask the question, why are you here, and who's helped you on your path, and just take a look at that for 2 seconds. And you'll forgive me if I digress a little bit off the topic of today's shows, but it's one of those things that are important, I think, in society and into the side of the triad of mental health and spiritual health that we all look for from time to time. I want to talk about this blood supply, the circulation, but there's an interesting topic. There's a caller that's sitting out there, and I'm going to talk to him a little bit. And because I think we are on the right subject, the right topic. George, are you still there?
I'm still here.
Thank you for calling, sir.
I wait all week to hear you. I know that sounds kind of funny, one man to another, but you should be syndicated. You're just not out there enough.
Well, take a look at our website coming up, and I think you'll find some interesting things there.
Terrific. My question is, I've been listening to this gentleman talk about cryogenic cooling for athletes and people with arthritis and that type of thing, and I was wondering your thoughts on that.
Well, cryogenic cooling, you're dealing with blood supply that's not moving, and they've gone to the point now where they're using chambers, cryogenic chambers, to reduce pain and inflammation. And the problem is that it's not that it doesn't work, and a lot of this came off of divers who ended up going too deep and too much nitrogen buildup in their body. It can work, but again, it's a symptomatic representation or approach to a problem that has more far-reaching tentacles than that. So what I'm saying to you is this: the topic that we're talking about today, with blood supply not being adequate to the disc spaces, and that happens for a lot of reasons. It can be a neurological situation. For example, you have a big blood vessel coming out of the heart called the aorta, and off of that you have a lot of small collateral vessels. But you also have nerves that allow that to go to their end targets, and they usually come from the neck, by the way, in the upper portion of the thoracic area, the chest cavity. And if those nerves are being impaired because the vertebrae aren't moving the way they're supposed to, then they're not going to fire properly. And that's one of the reasons, by the way, that you end up with the problems that we're talking about, where you get the stagnation, and then subsequently it's a catch-22 because the disc spaces aren't getting the blood supply. If they're not getting the blood supply, they're going to degenerate. They're going to break down. They can't get the oxygenation. So when you have pain and inflammation and you start using things like cryogenesis or a cryogenic chamber, you're forcing oxygen into the tissue to resolve something. It's like using an aspirin for pain. You're not asking the question why the pain's there to begin with. Does it work? Yeah, there's a lot of evidence that says that it does have significant value, and but if you don't go back and handle the problem, then the problem continues to reoccur. So it's not something that I'm against. And cryogenic chambers are being used for all kinds of things, even skin problems, and forcing oxygen into the tissue. It can really can make huge differences. Again, you're not treating the problem. You're not treating the underlying situation. So they drop the temperature down. They use pressure to force the circulation where it needs to go. George, I don't know if I'm being beneficial to you or giving you any information that you really want. It's it's a toss-up at this point. Don't go away. I'm going to come back and I'm going to talk about it just a little bit more after the break.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, we're in studio, always for you. 888-630-9625. That's how you find me. We're talking about pain that is a result of lack of blood supply and neurological inputs to the intervertebral discs, the joint spaces that make you bend and twist from your spinal column. George, are you still online? George? Okay, so we lost George. He called in and he asked about cryogenic pooling, which and I'm making the assumption that he's talking about cryotherapy or chirotherapy, CRYOTHEARPY, and the application is one that has come from a lot of different areas. It's a combination of first started out with dropping the temperature very, very low in the body, and the whole idea is to decrease vascular flow and decrease the replication of cells and so forth. And then they started combining it with something called hyperbaric chambers, which will change the pressure gradient. That's a spin-off of some of the things that I said earlier that has to do with the decompression chambers that divers would have to use when they had too much nitrogen because they went down too deep and stayed down too deep. It's been used for a lot of different things, from spinal problems to cancer to things like psoriasis, headaches, and there's a lot of back and forth on it. The intercellular space is the fluid. What the thought process is, when there's a tumor formation or there's cancer, that they drop the temperature so low with liquid nitrogen that they're trying to crystallize the cells and destroy them. And there's a lot of potential side effects with it, and I'm not necessarily a fan. I really like the use of hyperbaric chambers because they do work, but when you're using cold in cryotherapy or cryogenic therapy, you're you're looking at immediate loss of circulation, vasoconstriction. You're looking at, and what they hope to occur afterwards is a reflexive. It's like you do one thing, and then the opposite occurs afterwards. So they see an increase of vasodilation. They see a decrease in the local capacity of the tissue, and then an increase afterwards. So, there's a lot of literature. It's starting to come out. It's not something that's been there for decades, but do your homework on this thing. And the bottom line is, I can tell you what it does. I'm a little, sheepish on it, so to speak. But there's a look up anything from cryogenic chamber therapy. I think if I remember, Dr. Oz had done something on it a while back. But you're talking about cooling the body down very, very significantly. And I mean, to the point where the patient may have frostbite as a result of it. And they're putting them in these chambers for a period of time, a short period of time, but nevertheless, if I remember, this whole process started in Asia, I think Japan or Korea. I'm pretty sure it was Japan. And it was a group of not Japanese scientists, but other scientists that had come from other places, and took place in using sports injury. Again, I'm pulling from memory at this point, so you'll have to forgive me. But anyway, George, I hope I answered your question, and at least somewhat. Send me a note. I'm going to do a little homework on this, but that's as much as I can remember at this point. 888-630-9625. That's 888-630-9625. We're talking about the pain patterns that occur because of lack of circulation. And in this situation, I've never heard of cryotherapy being used to fix this. But before we broke for the news and information, we were talking about joint spaces like the sacroiliac joint in the low back and the lumbar spine having a very complex set of vessels that went all over the place, and it supplies the sacrum, that wedge-shaped bone in your low back, and also the low back lumbar area, and it's below the fourth lumbar vertebrae. And if anything is not working properly, if the blood isn't traveling the way it's supposed to, then you're going to hurt. You're going to have pain constantly. That's one of the reasons we see some athletes that end up with degenerative hips or degenerative legs, and they don't know where it's coming from, and they just say, well, it's just a wear and tear phenomena that occurs with some people. Well, what happens is that these nerve roots aren't firing, so it impairs the circulation to the joint space. And so you have to look at the why behind it, as we've said, on a repetitive basis. So when you have degenerative joints, if you have a hip that's breaking down, and there's really no reason for it, one of the things that you have to look at is, why is the circulation not being provided adequately? Because the reason you have that degeneration is because the circulation's not working. So you have these arteries that are in there, and they go up and down the spine, but they affect the disc specifically. And there's branches, and if you get into anatomical books, you're going to see there's middle branches, and there's superior branches, and there's inferior branches, and so forth. But in this lower portion, in this part of the spine, you have three main vessels in the system, and they're kind of named along with the arteries that they flow with. It's called the anterior spinal artery, and then the left and right dorsal laterals and so forth. But don't worry about all that nonsense. I just want you to know that you heard it one time. And the problem is that these arterial supplies that run with it supply 80% of the blood supply to the spinal cord. You didn't think about that, did you? That the spinal cord actually has a blood supply, and it comes off of these neurological pathways. And if it's not working, you end up with degeneration, loss of sensation, loss of feeling. Things don't repair themselves anymore. 888-630-9625. That's 888-630-9625. Bernice, happy Easter, hon. How you doing?
Oh, pretty good. I have a question about, I have a friend that she's about 88, and her lower back hurts. It's something to do with her discs in her lower back. And what kind of surgery, she'd like surgery, but then she thinks about the consequences, you know.
What has she done before even considering surgery? Has she tried any conservative care of any kind whatsoever?
No. Mm-mm.
All right, so before anybody has surgery, that's the last resort. That's the thing that you do when everything else fails.
Uh-huh.
So I would encourage her to go to somebody who does acupuncture and does some manual work and uses low-energy light laser and would change a few things in her dietary patterns as well. So, for example, one thing that most of us are deficient in is coenzyme Q10.
She does take that.
Okay, but what level? I mean,
100 milligrams, it's liquid?
Tell her to triple it.
Triple it? Okay.
Yeah, at least go up 3 times. But make sure it's a good natural organic source, but at least triple it. And then you begin to see changes. Vitamin E will change circulatory patterns. We're also seeing low levels of zinc across the board in people who have spinal degenerative disease.
Uh-huh.
Most people are deficient in zinc.
How much?
It depends on the patient. You can't get in trouble with 30 to 60 milligrams, but that's just the beginning stages. And because I don't know her, she's not my patient.
Uh-huh.
I can't tell you to crank it up, one way or the other. You want to increase the circulation. If the spine is not working the way it's supposed to, then there's no way that anything is going to be functional. Pain and loss of circulation is going to be the keynotes. So what I would do is encourage you to get her someplace, to get her somebody to do that. If you want a referral, like always, just send me a note at rosellecare.com, and I will send you a name or two or three of some of the people that are associated with our organization.
Okay.
And happy to do that. But tell her surgery is the last thing she wants to consider, not just a knee-jerk reaction and go do it now. Particularly at her age, if she has circulatory impairment, she's a high risk.
Uh-huh.
And so you want to repair the body naturally as best you can. And surgery, at best, is 50% successful. When they're saying successful, that means that they're not making it worse.
Uh-huh.
Okay, so be very, very careful. Send me some data on her, and I will happily send you a referral.
Okay, and also I had a question about my nephew. He had surgery not too long ago, about a month ago or 2 months, and they scraped out some bone out of his back in his spine somewhere. So what would cause that? An injury?
What was the surgery? What was the surgery for? What was he? Did he go for pain?
His nerve was like getting pushed against inside against his.
How old is he?
He's about 35.
Okay, so it could have been just a protruding disc. It could have been, he could have had something called a spondylolisthesis where the vertebrae is moved forward. Unlikely unless he had, had trauma. There's a lot of little things that can cause that, but without seeing the X-rays, without knowing more of the history,
okay.
If they're going in and scraping something out, my guess is that they did a laminectomy where they pulled a little piece of the disc out, particularly at his age. But nevertheless, I can't tell you. There's a plethora of different things there, hon.
Okay, I'll have him email you.
Thank you. Take care, Bernice.
Okay, thank you.
Have a great day. 888-630-9625. That's 888-630-9625. We're talking about impaired circulation to the joint spaces, and what is it? Is it the chicken or the egg? Is the circulation being impaired because there's a problem with the spine, or is there a spinal problem that's causing the other to occur? So what we're seeing is that in many situations, the blood supply is being impaired because the neurological system isn't working. And we're talking about impaired circulation to many different areas, including the brain and the heart and the organ systems. If you have degenerative disease of the spine or any joint in the body, you more than likely will have clogging of the arteries. They go hand in hand, particularly when there's no evidence of trauma or injury. This has to be looked at as a whole situation, not just as a compartmentalized thing that your doctor says, here, you have impaired circulation, take these drugs, or you have spinal degeneration, do this. This is one of those catch-22s, my friends, that generally you've had your fingers in. Helen, how can I help you? Thank you for calling.
Yes, hi, Dr. Roselle. I wanted to ask you, this is regarding sciatica, a home remedy someone's using. I want you to tell me if it's safe to use.
Okay.
In the morning, she has coconut oil on toast. And then during the day, before each meal, she has 2 tablespoons of apple cider vinegar in water, along with her other food and so forth. And is this safe to use, this apple cider vinegar and so forth?
The only thing that you said that may not be good for her is the toast, but the coconut oil and the apple cider vinegar are fine. The coconut oil, you always want to have an organic form. We use a tremendous amount of coconut oils, particularly when it comes to wanting to produce certain levels of fatty acids in the body, but it's great for people who have memory problems, whether it's an old age dementia. We also use it with Parkinson's. There's a lot of anecdotal information, clinical anecdotal information out there that coconut oil works dramatically well with Alzheimer's and dementia at very, very high levels. You don't want to cook it. It has to be at room temperature. So as soon as you take coconut oil, even though that it looks thick, you put it in your hand, it's going to turn to liquid. So it's fine. That's not an issue. The apple cider vinegar, you want to have an organic form. You want to take it in the morning on an empty stomach. It will help alkalize the body. Now, relative to sciatica, if the sciatica is due to inflammation, then the coconut oil and the apple cider vinegar can be useful. However, if sciatica, which is leg pain, by the way, for our audience that's not quite familiar with it, it's pain that goes down the leg, and the sciatic nerve is 5 nerves. It's not just one. It's a bundle of 5 nerves, and depending on where it's irritated, will determine the pain pattern and the distribution where it's located. So there's a lot more to that. Is it harmful? No, it's not harmful at all. It actually will help her. Tell her to get rid of the toast because most of us are gluten sensitive.
She's been to doctors, and this that she's been using, she has no more pain, and she's just feeling that this is doing that. She's,
well, then what's happening is she's controlling the inflammation with it, and tell her to keep doing it. It's not going to hurt her at all.
Mm-hmm. And thank you for mentioning spiritual.
Oh, you're welcome.
We appreciate that, Dr. Roselle.
You're welcome, Helen.
Okay. Thank you.
Happy Easter.
Bye-bye.
Betsy, Williamsport, Maryland. How can I help you?
Yes, sir. This is a wife being concerned about her husband. My husband, a couple of weeks ago, noticed that on his spine is swollen, and he wanted me to look at it because it's in the middle, but upper part of the middle of the back. And you can see it, through his T-shirt and all. It's like it's in the bone. The bone itself is like it's swollen, if that makes sense.
Betsy, let me ask you a real quick defining question. When you put your hand on it, is it movable or is it solid?
Solid.
Okay, so you can't.
Pain.
And it's painful.
No pain.
Okay, so when you push on it, is it soft or is it hard?
Hard.
Go get it checked out. Go have him.
And he's telling me no because of X-rays, because he thinks the X-rays is going to be more harm than good.
Well, in some situations that's true, but a spinal X-ray at this point, or somebody who really understands the spinal system, I think at this point is critical. Anything that is solid is hard, that suddenly shows up, that wasn't there before, that doesn't move is something that you want to look at. So that rules out a couple other things, but obviously, you know that I don't like drugs and surgery, and that's like the last thing in the world that I would ever tell you to do. But in this particular situation, go get it checked.
You are such a blessing, and I hope you realize how blessing to the people you are, Doctor. And we are going to be seeing you at the April the 19th. We already have our tickets.
Oh, great.
We're excited to come, and we're hoping that we'll be blessed to be able to meet you.
Make sure you will. I'll be there. We'll have some fun, and I'm going to stay. I'm going to do the introductory to the film, and then we'll show the film, and then afterwards I will answer questions, and I'll stay afterwards just to say hey to everybody.
Perfect. And I hope and pray, because he's listening right now to us, I hope and pray this will give him the little nudge that his wife's intuition is right to go get this checked out.
Yeah, it's time. That's one of those things, Betsy, that you don't want to ignore. So I look forward to seeing you, and if I can, listen, I'll even do this. If he wants to talk to me, call my office and tell my staff that you and I talked on the radio, and I will call him. My gift to you.
Thank you.
Betsy,
and may the Lord bless you, and happy Easter.
Thank you, Betsy. Happy Easter to you. We're coming up to a break, and then we're going to come right back and kind of give you a couple ideas to help where maybe other things wouldn't have been prosperous for you along the line that we're talking about. Circulation to the joint spaces and your longevity. This is Dr. Tom Roselle. Don't go away.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, showing at the Angelica Film Center Mosaic in Fairfax, Virginia on Sunday, April 19th at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hello, America. It's me, Richard, H&R Block Tax Pro. Did you know that more than 70% of Americans get refunds? If you haven't filed yet, there's no better time to come in and let the tax professionals at H&R Block get you every penny you deserve. Visit hrblock.com to schedule an appointment today. Same-day appointments are available, but they're filling up fast. Get your billions back, America.
Not everyone gets a refund. Statistics based on IRS data.
Today, Easter Sunday, is the last day for the Sears Outlet Inventory Reduction Sale. Come in and save hundreds off kitchen appliances, washers and dryers, living room furniture, mattresses, outdoor patio sets, grills, lawnmowers, fitness equipment, and more. Plus, receive an additional 15% off almost everything store-wide for extra savings during this inventory reduction sale ending today. Visit the Sears Outlet locations at Potomac Mills and in Wheaton.
Today, more than ever, Americans need a means to protect their life savings. Birch Gold Group offers peace of mind for your nest egg through a rollover to an IRA backed by physical gold. Take advantage of the long-term stability that gold provides by investing in a gold IRA from Birch Gold Group, the precious metal IRA specialists. Call Birch Gold Group today at 888-999-5191 and receive their free information kit on gold. Call 888-999-5191. That's 888-999-5191.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio today. Happy Easter and a very, very happy Passover. 888-630-9625. That's where you find me every Sunday right here at this microphone, bringing you the most intimate and updated information on integrative and natural therapeutics, things that you can use, things that you can do for yourself and your family. Really, that's what it's all about. You know, my book, Ageless Health, Health is a Do-It-Yourself Program, was written specifically for you. And it's a guidebook. It tells you really how the body works, the intimacies, in very, very specific but very understandable language that anybody can grab a hold of and say, oh, really? And you know, we're going to update that book probably the end of this year, but nevertheless, pick it up and go through it and understand how that body works and how everything that is around you, everything that you think about, everything that you do has an impact, has an effect on your system. To ignore that is, you know, you're basically giving control to somebody else. You're saying, you know, I really don't have any input into my life or into my health and my body, that it's, you know, circumstantial, it's happenstance, it's just because of those things. We're talking about circulation to the disc spaces. We're talking about circulation to the bone structure and why you, in many cases, have all kinds of joint-related pain, structural degeneration, spinal stenosis. So we have all this stuff going on. Even though the cells of the disc spaces can survive in very, very low oxygen, meaning not enough blood supply, circulation to it, you know, there's relatively high acidic environment that it develops, right? And so something called proteoglycans. Now, what does that mean? That's the stuff that actually repairs the disc. It can't get in there. It can't work. And we end up messing it up on a regular basis. I'm going to take one more phone call today simply because it's one of those days I think I should do that for you. Ronnie, how can I help you?
I am a 55-year-old male. I was diagnosed with scoliosis and arthritis in my spine, and I am experiencing increasingly pain symptoms. They have me on oxycodone 5 milligram fast-acting pills.
Not a good idea. Go ahead.
They're not working for me anyway, but the pain is just increasing. And I was just wondering, is there something else that I may be able to do to help myself?
Yeah, absolutely, yes. Ronnie, here's the thing. Obviously, and I don't have a lot of time to get a complete history on you, but at 55 years old, scoliosis has probably been there for the majority of your life, unless you had a very severe accident, that affected the spine or your skull that causes scoliosis to occur.
Well,
now,
I did have a stroke. I did have 2 strokes.
Okay, well, then that tells you have impaired circulation along the lines of the things that we're talking about today. So subsequently, what you have to do is you have to approach this in a multidimensional facet. You have to look at not only the structural system, but you got to look at your dietary patterns and and the energetic pathways of your body. So if I was in your particular situation, what I would be doing is changing how my biochemistry, was unfolding to begin with. If you, and my mantra of sugars, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, if that's in your diet, stop it. Increase your water supply dramatically. You want to make your body as alkaline as you possibly can. That means if it's green and colorful, you can have it. And if you want to eliminate dairy and pork and things of that nature, and eat a lot of free-range foods. Eggs are not bad as long as they're organic free-range foods. Now, I'm giving you just a snippet. Obviously, it'd have to be individualized for you. Lots of water. Whatever your body weight is, divide that in half. Whatever that number is the number of ounces of water you should be drinking every day if you want those disc spaces to begin to expand. Little things that won't get you in trouble. I would increase or start taking some vitamin C, 1,000 milligrams up to maybe 3 to 4 times a day. The side effect of vitamin C, if you're getting too much, is that your stools will get a little loose. So if that's the case, you break it down a little bit. But there's so much more that you can do. The scoliosis is probably not going to be fixable at your age, depending on if it's adaptive, meaning if it's already molded to the curvature, which means it's been there for a long time. But the discomfort, the pain, the vascular impairment, the fact that you've had strokes, those things can be supported and made better, Ronnie. And so there's a lot you can do. You're in the district. There's some people that are in that area. If you send me a note at rosellecare.com, I will make a recommendation for you. There's one of our doctors that belong to the organization that I'm chairman of that has just recently moved into that area. It would be a very good choice. Let me know, and I will make that referral. Ronnie, thank you very much. I appreciate your call, but you have to be proactive on this thing. But what you've told me is that you have impaired circulation. Tells me that because of the strokes that you've got a structural deficit that's probably been there for a long time. You need help, not drugs. You need to get off the oxycodone, but you need to do it with somebody who knows what they're doing and can take you step by step through the process that can allow things to heal for you. And you can, at your age, you can be a whole lot better. The problem, as we said, if you have degenerative disease, you have cardiovascular problems. If you have cardiovascular problems, you have degenerative disease, and your longevity is not great unless you reverse these things and you turn things around. We're coming to the end of the program. Again, unfortunately, way too short. Love talking to you. Love answering your questions. Love helping, pointing you in the right direction. I'll see you next week, same time, same old place. This is Dr. Tom Roselle. Bye.
Pay attention, I'm educating you.
Mark Levin.
Nobody is better prepared to talk about this than I.
6 to 9 p.m.
You won't want to miss it. It's going to be spectacular.
On Washington's Mall.
WMAA.
Where Washington comes to talk.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments.
Attend Uniquely Male Menopause with Dr. Matthew Adams on Wednesday, April 15th at 7:30 p.m.
Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
105.9 FM and AM 630 WMAL, Washington, a Cumulus station, where Washington comes to talk. News now.
WMAL.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Hip and Knee Pain with Dr. Harlan Browning on Wednesday, April 1st at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.